on managing risks of going missing amongst persons living with dementia by building capacities of search and rescue personnel, first responders, and communities. So we really look forward to hearing your presentation. Thank you, Lily.
Thank you, Lorraine, for the kind introduction. I'm going to share my screen here. Bear with me. There we go. Is this okay? I'm going to assume it's okay. I can't hear anything.
Perfect.
Can I just go ahead?
Yeah, looks great.
Oh, thank you. Okay. I was wondering, I didn't want to start talking. So thank you so much, Lorraine. Hello, everyone, for your wonderful introduction. Good morning to the attendees in Canada, and good afternoon to our colleagues in Kalmar, Sweden. Thank you for inviting me to provide a keynote presentation on innovative strategies to reduce risks of going missing among persons living with dementia. As Lorraine mentioned, I oversee the Aging and Innovation Research Program at the University of Waterloo. It consists of about 20 staff and research trainees, and here's a sample of just some of my team members. We have an adjunct assistant professor who actually is located at the University of Alberta, 2 research coordinators, and 2 postdoctoral fellows. And our research teams span across the country. Today, I'd like to cover 3 main topics. The first would be on backgrounds on persons living with dementia at risk of going missing. And the second is just a quick overview of the prevalence and antecedents of missing occurrences. And then finally, the bulk of the presentation will focus on approaches to managing risks in this population. As Sophia said yesterday in her introduction at the conference yesterday morning, innovation is not just about technology, but includes thinking and applying existing knowledge in new ways and new contexts. And this is certainly the case when it comes to innovative solutions that facilitate healthy aging among persons with dementia. In Canada, more than 400,000, probably closer to 500,000 now, Canadians are living with dementia. And the prevalence of dementia in persons who are 65 years or older has been increasing, and is about 77% of the population. And the incidence is about 14.3 per 1,000 seniors. In Sweden, the prevalence is about 9,000. They have, of course, a much smaller population. Worldwide, about 55 million people have dementia, and this is projected to rise to 78 million by 2030. And 139 million in 2051, according to the World Health Organization. With increasing numbers of persons diagnosed with dementia and with the associated risks of getting lost and going missing, this is a real public health concern. Headlines like the ones that you see here on this slide are becoming much too frequent. Just last week, in fact, a woman left her home near Hamilton and was found deceased just 2 days later. In the case of Shin No, a gregarious church minister who did not want his social network to know that he had dementia for fear of stigma, was reported missing in 2013. And people said that at the time when he was reported missing, his social network said that they had seen him, but they didn't realize that he had dementia and he was lost and needed help. So there's a much bigger, I think, social context to this issue that intersects with culture, with the way we perceive the dementia and also the stigma around it. It's estimated that 3 in 5 Canadians with dementia wander at any one time. And for families, this can be one of the most emotionally wrenching experience. The consequences of getting lost vary from minor injuries to high search and rescue costs and even death. Some seniors, like Mr. No, who became lost in 2013, has never been found. With cure for dementia nowhere in sight, this raises concern as to how wandering can be managed. And this is not an issue that only happens in Canada, but it's around the world. For example, it's estimated that over 16,000 cases per year are reported in Japan. And this number jumps to 500,000 older adults who go missing in China every year. Thus, the risks of going missing is a public health, as I mentioned, concern, and it's also a safety and a community issue. The burden on family caregivers, healthcare professionals, and first responders, such as police and search and rescue volunteers and personnel, is large. And the impact is quite major, as the headline showed in the previous slide. But there are ways, as we're discovering, to intervene and to mitigate these risks. The strategies that we are proposing in our research program aligns with Canada's National Dementia Strategy, which was released in 2019. Sweden also has a national dementia strategy that was launched in 2018, a year after the World Health Organization's dementia strategy, which was launched in 2017. Our work also follows the principles outlined in the National Dementia Strategy and also the pillars of collaboration, research and innovation, surveillance and data, and information sources and skilled workforce. We focus on preventing or delaying onset of dementia by encouraging active engagement and on enhancing quality of life by creating safe environments. So our work aligns with the principles and pillars, as I mentioned. With respect to improving quality of life in people living with dementia and also for their caregivers, we strive to eliminate stigma and to promote measures that create supportive and safe dementia-inclusive communities. We also dedicate some of our research on assistive technologies and community-based services that help people living with dementia to stay at home longer, to reduce hospital visits, more economically and independently live their lives in the community with some of these technologies. Much of the data that's available on wandering is from the United States. Comparatively little is known about the Canadian context, where climate, geography, funding, and also culture vary. Although it's estimated that 6 in 10 people living with dementia will show, wandering or walking behaviors such as random walking, lapping, and pacing. Not all persons with these kinds of behaviors actually do get lost and go missing. So it makes it very difficult to collect data. Sometimes there is embarrassment on the part of the care providers to report someone who's gone missing, or they feel at risk of being sued or liable. So sometimes they don't report until it's too late. But we think that all persons with dementia who are ambulatory or who drive are at risk of getting lost and going missing. And it doesn't have to be a repeat incident. It could be a first incident that can happen at any time. In Canada, we're also particularly concerned about underrepresented populations. We know that the prevalence and incidence of dementia in Indigenous populations, for example, are disproportionately higher than the general Canadian population because of associated, social risks and also health risks. So the number of people with dementia that go wandering and wander and go missing is steadily increasing across the country. We have anecdotal evidence from some of the police services, but data is not consistently being collected. We think in some jurisdictions, older adults make up nearly 50% of the search and rescue missing persons reports. And this is up from what was only 5% of the SAR cases in the past. I just want to take a little side trip here to just talk about the terminology wandering, whether or not to use it. For some of us in Canada, I think it's probably an even split. There's a portion of service providers, researchers who prefer not to use the word wandering because of the negative connotations it brings up. It is consistently used in the US, where it emerged first in research, and so it is a research terminology that we do need to use to search. Our colleagues in the UK refuse to use it. In fact, we've submitted conference abstracts that they've accepted, and they've come back and asked us to replace the word wandering with some other terminology. So some of the negative associations with the term wandering is that it only refers to aimless behavior, and not everyone who wanders get lost or that are walking aimlessly. As I mentioned, some people think that it connotes very negative behavior. And so we've been encouraging ourselves anyway to try and think of other words to use, such as walking, wayfinding. Nevertheless, these kinds of behaviors that put people at risk for going missing are typically manifestations of boredom, restlessness, pain, discomfort, confusion, agitation, etc. And it's important to recognize this because often by addressing what the root causes of these kinds of behavior may, for example, by providing structured activities, can very easily remove that behavior. So just wanted to make that comment about the terminology in case some of you are cringing about why I'm using it. I want to just talk a little bit about, while we're on statistics and data, about a recently completed master's thesis completed by Larissa Kowalski from Western University. And I thought it was a very well-written and certainly one that we refer to a lot. The title of her thesis is Hiding in Plain Sight, Missing Person Reports from Two Cities. What Larissa did was she obtained data sets of 616 closed missing person cases from two urban law enforcement agencies. These are anonymous. One was located in BC and one was in Ontario over a period of 4 years. And the results show that, so this was a retrospective analysis, and her results show that community dwelling older adults were more likely to be reported missing, that males were higher than females, although it was like a 60-40 split, that they were more likely to be reported missing if they were living in a private residence in the community, and that over 41% were repeat missing cases. She found in the data, there were many cases of repeatedly and frequently going missing from care facilities and hospitals. So unlike the myth, people think that the risks are higher living in private residences. In fact, her data from these two urban police service sites show that 48%, almost half of the reported cases occurred from private residences. As high as 20% occurred when an individual was in a care facility, just over 10% in the hospital, and then on the street or in the open space was 8% and 3%, and then others accounted for about 11%. So I thought that, first of all, it's very rare to get this sort of data. We've worked with Calgary Police. They collect data only by age, typically by age and gender over the years. And we do see increasing numbers of older adults, in particular males, who are reported missing. But we don't know whether those are due to we don't know where they occurred, the last seen location, and we don't know whether they were due to cognitive impairment. The Durham Police in Ontario collects very detailed data, something similar to what Larissa reports in her thesis. However, they don't report this data, they don't share it. And the reason is because anytime we're dealing with the variable of cognitive impairment or dementia, it is considered to be health data and protected under the privacy legislation. And so herein lies the challenge with lack of data, that the privacy legislation is actually what is affecting our ability to collect proper data. Just out of interest, also want to share with you a little bit about Larissa's qualitative analysis. So she went through the files and found that they generally categorize into 3 themes as it relates to the context of the cases that went missing. Aging with a pathology was one theme. So this would be the case where an individual was in, say, the early stages of Alzheimer's disease. They became confused by changes in their environment. She discussed a case where there was a block party and there were a lot of cars parked outside, and that change in environment disoriented a particular individual, and so caused the individual to wander in order to look for home or to walk away from the home. The second theme was striving to maintain independence. So there were a set of cases that she reviewed where individuals with dementia felt that they were being monitored too much by their family members, of course, with good intention. These typically are individuals who are physically still very well and very strong to go out and walk about. And so they do that to get away from the over-monitoring experience. They get lost, and then they become very embarrassed, and they don't want to admit that they're lost, so they don't seek help. And then the third would be those individuals who just require enhanced person-centered care. So this would be the type of cases who would have dementia or cognitive impairment. Again, they don't admit it, but they're not satisfied with the level of care that they're giving. So really, it's about the quality of care. They're not able to express what it is that they need, and so it results in them leaving their place of residence or seeking another environment. So we know some data has shown us, although again we're not entirely certain. So more research needs to be done on this. But there is some data that suggests if an individual goes missing, has a cognitive impairment, and is not found within 24 hours, about half of them will be seriously injured or diseased. There is another myth out there. So the first myth I wanted to dispel is that all people who go missing with cognitive impairment do so from their own homes, and that's not the case as we've seen in Larissa's data. But the other is that for those of us who watch a lot of crime TV, that we think you have to wait for 2 days or 48 hours before you report anyone missing, and that's definitely not the case. I know in our work that we did with the Calgary Police, they will put everything aside and prioritize an individual with dementia or cognitive impairment, and they will dispatch as many resources as they can to search for the individual, even when there are other cases of crime going on. So this is top priority, and we've been educating people that are communities that we work with. As soon as you think a person is missing, you call the first responders. The other is that because most of the time they are walking, they are mobile on feet. Nearly 95% of them are found within a quarter mile. So there's a whole field of research that studies and describes an individual with cognitive impairment who go missing, their behavior, and their walking and navigation is very different from other people with other types of conditions. So this is why this needs to be studied. Sometimes, so it's not the same as the Amber Alert, where an older dog goes missing, you start to dispatch vehicles when really on foot is the way to search for them. And it's really important to understand their behavior, what they were thinking at the time, what would be the motivation to direct them in a particular pathway, and then that would be the best clues for searching for an individual. So now we're going to get into the third area, which is really the bulk of the presentation, and I'm going to talk about approaches to managing these risks, and I'm going to talk about them in three categories. The first category is low and high tech devices. The second is age-friendly communities, and the third is building capacity. Now, these technology does not, we're going to focus on low and high tech devices first, but these are never going to be effective in and of themselves. So they really need to be addressed or explored in the context of communities and also building capacity. We talked about stigma, for example, as being a challenge. So we'll start with low and high tech devices. So in this particular slide, this is the heading of a publication that that was published in a paper that was published in 2018 by our grad students, postdocs, and colleague at the University of Montreal. So this was a scoping review. Before we embark in any research, we always work with the students to understand what the literature tells us. And that is always the best way to start with a proper research question. And so we were interested in knowing what technologies are out there for dementia-related wandering. So we identified 892 research papers that met our general criteria. And then specifically, we were able to pull out 12 studies that met more stringent criteria. Of these 12 studies, 83 technologies were described in the gray literature. And of the 83 technologies, there were 26 different types of devices, with GPS and alarms and sensors being the most common. But only 22% or 19 of these 83 devices were actually clinically tested in home or institution settings. So these would be the peer review literature. So we searched both types of literature. We found that there was a lack of usability testing and lack of user-designed approach to these kinds of devices. And there was also a lot of questions on the degree of effectiveness. So the rigor of the research that was done, the level of evidence was actually quite minimal. So we recommended an increased focus on usability testing, user-centered design, to enable developers to identify and prevent potential problems with the technology design. So here is the slide that shows low-tech and high-tech devices, and you'll see, so low-tech are the ones that are organized on the left and high-tech on the right, and you'll see locating would be the GPS technologies. The dark represents peer review literature, and the gray bar represents the non-peer review literature. And you'll see that the highest bars refer to locating or GPS kinds of technologies. Speaking of GPS technologies, we were the first team when I was at the University of Alberta to conduct a study funded by Alberta Health Services, and a vendor supported us in the project, where we actually tested a off-the-shelf consumer-based technology for that had gone through procurement process, of course, very rigorous procurement process. Tested the adoption and the usability acceptance of GPS, wearable GPS devices. There were 3 or 4 that we used in this particular study. So we had 45 client, caregiver, or individuals with dementia and their caregiver dyads, we call them, so 45 pairs that were included in the project. They used these devices, so it really depended on what device. So there was a pair of insole, there was a wearable, sort of a handheld device that they could put around their neck or in their purse, and there was a watch as well. They wore them, the study itself was about a year, but on average, they wore them for about just under 6 months. The GPS acceptance was extremely high. Overall, the expectations for the locator devices met both types of users, the clients or the individuals with dementia and their caregivers. This is just very how shall I say, simple demonstration. We had a lot of data, but we came up with an index to show usability and acceptance, and we summed them up, and you can see that the highest was 39. It was very high among all of them, and statistically significant compared to pre and post. You can imagine that feedbacks that we got from the participants. For those with dementia, some of them said it gave them freedom and peace of mind. It provided them with a sense of security. The picture here is a picture of a woman who actually lives in Calgary and used to design costumes for the Olympian skaters, actually, some of the famous skaters. And she progressed with her dementia throughout the study, but was really took a lot of comfort in being able to go out and walk. She loved to walk. And so she was one of those that thought the device provided her with a sense of security, because she knew at any one time if she were to be lost, she could press a button, and her husband would be monitoring, would be able to locate her and bring her back. The families thought, would give comments like, it gave me comfort to know where he or she was all the time. And peace of mind was one of the most frequent terminologies that the family members shared with us. So one of the side benefits of this particular project that we did in collaboration with AHS was that we discovered that, of course, with a prospective study involving participants who are living with dementia, we're going to get attrition. We're going to get individuals who are not going to be able to complete acceptance or usability types of questionnaires. And so in anticipating that, at the very beginning, we also had family members, family caregivers complete the surveys as if they were the individual living with dementia. It's never going to be perfect, but we actually did some analysis and found that caregivers were actually very good proxies for responses of dementia clients in our acceptance study. And so in almost all of the variables. And so they were statistically significantly correlated. So it gave us some comfort to know that even towards the end of the study, when an individual was not able to complete the survey in terms of acceptance and usability, that their caregivers could serve as their proxy. And another side benefit that came out of this particular project was a graduate student working with Don Joswishian analyze some of the data and identify what were the characteristics of successful collaboration in evaluating this particular innovation and what we learned from the GPS locator technology for dementia clients. It's I put this up because I think that innovation absolutely requires the technology or the device or whatever it is you're studying to be conducted in partnership with organizations that are deploying these technologies, that are employing service providers that are going to be using this. We can't keep them in the laboratory at the university. And so she came up with this model that talks about the implementation of innovation, that you have the innovation itself. You also need to, at the very, very early stages, be collaborating and designing the study so that it is going to be successful. And if you read the paper, you'll see a long list of recommendations, lessons learned. It was just fantastic. Of course, one of the things, it won't be a surprise to the participants in this particular conference, one of the biggest barriers was early on was going through ethics. It took a long time, and it was the first time at the University of Alberta, I think at any institution, academic institution, where the use of GPS monitoring device with a vulnerable population was being put through ethics for approval. And I remember spending hours with the ethics committee explaining and implementing recommendations that they suggested. So it may not be a big issue now because it's so common to have monitoring technologies, home health, but you have to keep in mind when this study was done, that was before any of that was out there. And I believe we were one of the first to break this barrier, but we persisted, and we got also a publication out of this to explain why we were successful. So after the ethics was passed, everything else was great. And that was partly because of the great partnership we had with AHS. So that was the low and high-tech technologies from our perspective. I'm sure many of you have your own experiences. And then what I'd like to talk about now in terms of the next approach for addressing risks of going missing would be age-friendly communities. I know Calgary is very progressive in terms of senior-friendly community, and one of the leaders in this. I'm going to take the perspective of Silver Alert, and I think that if you talk about dementia-friendly or senior-friendly communities, a lot of people will probably tell you that, or would agree that a Silver Alert would make your community a little bit more senior friendly, because it means the community is keeping an eye out for for individuals who go missing. So some of you may be aware that recently there was a petition to the Government of Canada for Silver Alert in Canada, a publicly funded one, I think. We know in the US, we've studied, there's lots of publications out of the US, they do have a Silver Alert. It's state funded. In fact, all but 5 states in the US have a publicly funded Silver Alert program. And people ask, why not Canada? We have the provinces of Alberta and Manitoba have amended their Missing Persons Act to include the terminology Silver Alert. In fact, Nolana Neubauer, my postdoc, and I were involved in providing evidence to help move the Alberta legislation to missing persons to include the Silver Alert. What's interesting is that even though these 2 provinces have amended the Missing Persons Act, it doesn't, to include Silver Alert, it doesn't change anything, actually. It doesn't promise that there's public funding going towards it. It doesn't, there is no programming. In fact, BC has tried for many, many years to have a legislation around Silver Alert. They do not, it's never been passed. And part of it is because of the associated costs. I think policymakers are concerned about what the implications for costs would be. But yet BC does have a citizen-led Silver Alert program that I'll refer to a little bit later. By the way, there is a response from the federal government related to the petition. I'm against, I never signed it, a national Silver Alert program, and we can certainly discuss that in the question period if you're interested. So we very much promote community-based alert systems. And this is a paper that was just recently published on a mobile alert app that we developed when I was at the University of Alberta with a care provider, and also who came up with this idea. He was a caregiver for his father who has dementia, and also with the computing science department at the University of Alberta. And so this particular it's called Community ASAP, and it's localized Silver Alert. It's essentially, just very quickly run through how it works. Volunteers in the community would register. So anybody can register and say, I want to be extra eyes on the ground for getting an alert when someone goes missing. So you would register for this app. The individual who is living with dementia can also register, or they don't have to. When they go missing, this information about John Doe in this particular case would then be uploaded onto the app by a family member. And then when the person goes missing, it's reported. And then when the individual, there's details about when, where the person was last seen, and whether the individual had a walking device with them or any other identifying feature. And then when there's instructions as to what to do when a volunteer locates the individual. And by the way, a volunteer can choose up to 5 radius that they want to be notified. So I could choose, for example, a several kilometer radius from my work office, from my home, and from where I typically do my grocery. And if an individual goes missing within that radius, I would get the alert. And if I spot the individual, I don't approach them. I look at the instructions to see what the instruction tells me to do. I can report it, and then there'll be further instructions. When an individual is identified or found, then they're reported found, and the information is removed automatically from your device. So that's the essence of what it is, what the app is. And we tested it. It's very similar to the Purple Alert app that is used in Scotland, which currently has over 10,000 subscribers. The only difference is that this works in Scotland because it's community driven, and that the police use that information, whereas and anyone can send out the alert. Whereas in Canada, we're not able, again, back to the privacy legislation, we're not able to do that. We have to go through the police. So in order for an alert to be sent out, the police actually needs to check everything, rule out any foul play, and then they send out the alert the police service. So police services now use social media anyway, like Twitter and Facebook. And this would be just one additional feature that they would use to send out their alerts. So you can see that then introduces an issue with timing and the speed with which an individual is found. We engaged all of these partners that you see here. You can see Calgary's police service was involved, and other Alzheimer associations and organizations. We were funded by CABI for this. And we conducted a usability study. This is the team, all those individuals actually on the staircase at the Calgary Police Service. And we found that we are in Canada extremely concerned about personal privacy. There was a lot of service providers, persons living with dementia themselves, care providers, who really express a high concern about how the information that is released on the alert app would make the individual even more vulnerable, that once the information is released, they may be stigmatized, people can prey on them, and all of that. This is certainly a question we asked of our colleagues in Scotland with the Purple Alert, and they said it's not an issue for them at all. They've only ever had one individual who misused the platform, and they just were able to shut him down, and he wasn't able to access it anymore. So certainly in Canada, we have this app. We just need to find a way to implement it. So these are some comments, some more comments from some of the, let's keep an eye on the time. Okay. And additional comments. Okay. Also along the lines of the alert, because of the challenges that we were experiencing, we decided that in the fall of 2020, we would host an online national forum on alert systems. And we engaged all kinds of experts in the field. And we used, for those of you that are familiar, called a witness seminar kind of a process. We collected transcripts from this, and then we developed a policy brief. If you visit our Aging and Innovation Research Program website, you'll see the policy brief there, as well as the transcripts are there for anyone who's interested. The participants included individuals from the Purple Alert, included a few people that are living with dementia, included care providers, including Sam No, the picture you saw on one of the first slides, whose father went missing and who actually founded BC Silver Alert. It included Meredith Rowe, a professor at the University of South Florida, who began the research, the field of research related to wandering, and the co-founder of BC Silver Alert, Michael Coyle, etc. So lots of really high-profile individuals. Also include Kim Savard, Seniors Outreach Program at CARIA, which has a different name now in Calgary. So this is a really important policy brief that I encourage you all to access. I'm happy to send it to you if you like as well. And then the third approach to managing risk, this is the last area that I'll talk about, is building capacity, and really leads into the kind of work that we're currently being funded to do. And it is really about implementing the innovation, and that the new ideas and the practices and the policies, building capacity. And this is an innovation unto itself, and it's easier said than done. So one example of building capacity is the Rapid Response Project that serves the purpose of developing best police practice for police to search for lost persons with dementia. I mentioned earlier that people with dementia, when they go missing, they walk differently, and often they're attracted to water, those kinds of things. If they go in straight lines, they may not walk around a hedge, they may just walk through it. Those kinds of behavior really helps search and rescue to strategize how they look for these individuals. It consists of an advisory committee, which you see here, and that involves caregivers, our researchers, etc. And you can find this information on Finding Your Way Ontario out of the Alzheimer's Society of Ontario. So this is one of the projects we're using to launch across the country, actually, in our newly funded project. So It's also been written up and published in this paper if you're interested. I forget the year, but it wasn't too long ago. Another resource that I like to talk a little bit about is around development of a conceptual model that provides strategies for adopting guidelines for people who go missing. So this is also published, and you can read up about it, but I want to just spend some time to talk about this conceptual model and how we used it to develop 3 guidelines. So based on interviews, based on the literature and other sources of information, my postdoc was able to create this conceptual guideline, this conceptual map that addresses the factors that need to be considered when we're talking about safe walking, safe wandering. And the first is geography. We know in Canada, so this is again, remember we talked about the difference between the US and Canada. We know in Canada we have rural versus urban. So typically, if an individual is missing in the rural parts of Canada, say in rural Alberta, you would contact a neighbor. But if you're in an urban setting, you would probably contact the police right away. The geography landscape is very different as well. So all of this has an impact on how search and rescue is done, and whether or not a person, how they navigate and how they walk when they go missing. Another set of important factors that we identified in our sources of information is cultural and personal factors. So this needs to be taken into consideration, because while we may think GPS is a great device, it's not going to work for everyone. Some individuals, you don't have to be an older adult, but some younger people refuse to use technology, and they never will. So we need to take into consideration the level of trust. So for example, in Scotland, the Purple Alert works really well, whereas a similar app we developed here, the Canadian cultural setting just doesn't allow it, because we are so concerned about individuals' privacy. So we need to find another approach, or we need to address why it is that we're not comfortable using. So there are different personal factors, individuals. So those are really, really important. It's related to a stigma in the strategy adoption. So it affects whether or not you adopt a piece of technology. And it's not about trying to change people's mind, but it's about understanding where they come from and what motivates them to use or not to use technology. All need to be considered. And then the third sort of group of factors that need to be considered is perceived risk. So we have a whole field of research now that is looking at risk perception. And this can drive someone to be very adventurous and go out, or to be very, very cautious and stay home, or to use a piece of technology or not, that sort of thing. And then within that perceived risk, is what Nolana has coined as the Goldilocks principle. I don't know if they use this in Sweden, the story of the Goldilocks and the 3 bears, but essentially it's just trying to achieve a optimal risk perception. In other words, just the right amount of risk that is realistic. So we don't want someone who never feels they're at risk, and we don't want someone to always feel that they're at risk. That some healthy risk taking is very important in order to feel independent and to have autonomy. So that's the gist of this, but you can read the paper to get more background. This is another illustration of the Goldilocks principle that we've incorporated. So if you have very high risk perception, then you're very safety conscious. If you have optimal, you're independent as well as safety conscious. If you have no risk perception, then you are always striving to be independent. And so this may actually explain some of the 3 themes that Larissa described in her thesis as well. Here, I mentioned there were guidelines that were developed. So here's one of 3. So we developed 3 guidelines, one for people who are living with dementia to use, and this is the one. We developed a guideline, so very similar look to it, but for people who are caregivers, care providers, unpaid, so family caregivers. And then we have another one version of this, looks very similar, but for facilities, so for institutions that are looking after individuals who are at risk of going missing. And what you'll see is perceptions of risks of going missing on top, and then the strategies that are recommended for the individual. And you can see technology is certainly embedded, but not always. It really depends on your consideration of the individual's preferences. And you'll see also, remember our story about not calling the police until it's 2 days after they've gone missing? Well, here, always call 911 or go to a local business and ask for help. Don't wait and don't hesitate to call for help. And the back of this guideline is a list of available strategies. And this is all available online, so it constantly gets updated. It's been validated. We are working with the Waterloo. We have worked, it's completed now, with the Waterloo Games Institute to gamify this particular guideline online, so it looks very different, so people can go online. That's about to be released, and we're happy to share that with you. Just want to also give you some background on an online consumer guideline that we've developed. It's on hold now, but it's waiting to be updated. And this is, again, capacity building for those who are out there looking for the ever-increasing number of products that are available for consumers. Some are online, they purchase, and then Canadians realize you can't even use it in Canada because it's not associated with a mobile provider. And so it's really important to do your research ahead of time. But each product manufacturer is going to give you the information they want you to know. So what we've done is we've collected this. We get the product makers to also participate in this, and then consumers can pick the ones they want to compare, and then it'll compare apples to apples, oranges to oranges. So in other words, whether or not it's available in Canada, the cost, the product model, how long the battery lasts, that sort of thing, rather than trying to figure it out yourself. So this is a guideline we're working on again. We're gonna, it was hosted at the Alzheimer's Society of Ontario, and we're about to bring it to another organization to host. I think this might be the last resource for capacity building that I can talk about today. And it's a International Consortium on Dementia and Wayfinding, or ICDW, that we've created. We've held 3 meetings, and then the pandemic hit. And you're all welcome to join this. These are our partners that are, and there's ever increasing. I think Safeland actually is located in Sweden. And there's universities, Swedish universities, that are also involved. And I think I want to also just give you a little sense of what we are going forward with in our newly funded project. Miguel Cruz and I, so my colleague who's also an adjunct at Universe, we've just completed a paper. It's in press right now on technology adoption and diffusion in healthcare, the onset of COVID-19 and beyond. And we talk about the difference between adoption and diffusion. And certainly adoption is on an individual level, but diffusion is really what happened during the onset of COVID, is that populations then on a mass scale adopted particular technologies because they were forced to, they had no choice. And we want to be able to continue this in order to see rapid diffusion of technologies or diffusions of innovation. So remember, we're not just talking about devices, we're also talking about the practice, and we can certainly talk about practices. But you can see in this third graph here that technology A is diffused much more quickly over time than technology B. And that happens when you have a diffusion rather than just focusing on individual adoption rates. And that is in fact what we want to do in this next project that we're being funded by Public Safety Canada. Their mandate is to strengthen the national coordination of search and rescue. They want to focus on prevention, and they want a focus also on Indigenous communities. And that is what, in fact, we propose to do in the next 3 years. These are our 4 projects, and these really have to do with taking what is adopted in local communities and diffusing it across Canada. So we have the rapid response protocol that I talked about out of Ontario. We're going to diffuse it across 7 provinces, including 2 Indigenous communities. Toolkits for communities. So this is talking about capacity building. We're taking toolkits that was developed, is being pilot tested in Calgary. We're going to look at the one that's being developed in British Columbia, as well as in Saskatchewan, and then have them customized for various communities across our project sites, partners. And a guideline for return home interviews is something that we brought back from a conference on missing children and missing adults in the UK. And we think this is something that's needed in Canada. So we're going to try and develop a guideline for that. And data collection is so important. When that just reminds me, we are searching for a postdoc for this particular initiative to focus on data collection approaches. So we have 2 postdocs now. We're searching for a third one, so spread the word. These are the geographic locations of our 7 provinces. The Indigenous communities are coming out of Manitoba and Quebec. These are our partners that are involved in the project. And I'm going to finish with a 2-minute, or is it 3-minute video, and that's it. This is my very last slide.
A few years ago, Sam's father, Shin No, went out for his daily walk. Unlike his previous walks, however, Mr. No never returned home. Despite the tireless efforts of friends, family, search and rescue, and police, 8 years later, he is yet to be found. Potentially 40%
I don't think
of
we can see the
people living with
video.
dementia can become lost at some point during their journey with dementia, and after any type of situation, whether to cool off after a stressful event or while they're out and about in their community. The
Is that the case for
uncertainty
everyone?
surrounding missing incidents is enormous, and the adverse outcomes are heartbreaking. Lost and
Yes,
missing
I
persons living with dementia could experience difficult
Yeah,
climate
we don't see the video.
in Canada's
Did you want to? Do you have that YouTube link?
complex task.
Yes, I gave it to.
Sometimes they're unable to get back home safely. Some of them never return.
So is that the case? No one can see it?
Here, you can pull it back up here to me. See, make sure we have it.
Okay. During the testing, I think I shared it with you, the link.
Yes, let's make sure.
I'm sorry.
Yeah, that's okay. No, I think we'll just need you to. Now, where'd it go?
To stop screen sharing.
Yes.
Okay.
Stop sharing, and then the video will go up.
Okay.
And yeah, turn off your share screen.
A few years ago, Sam's father, Shin No, went out for his daily walk. Unlike his previous walks, however, Mr. No never returned home. Despite the tireless efforts of friends, family, search and rescue, and police, 8 years later, he is yet to be found. Potentially 40% of persons living with dementia can become lost at some point during their journey with dementia, and after any type of situation, whether to cool off after a stressful event or while they're out and about in their community. The uncertainty surrounding missing incidents is enormous, and the adverse outcomes are heartbreaking. Lost and missing persons living with dementia could experience difficult climate conditions, especially in Canada's unforgiving weather and harsh terrain. Wayfinding can be a complex task for them. Sometimes they're unable to get back home safely. Some of them never return. When a family faces a missing person incident, they may experience stress, anger, anxiety, and guilt. Every day, situations like Sam No's father occur across Canada. It is clear that as a country, we have a long way to go when it comes to effective strategies to prevent missing incidents and to find missing persons living with dementia. Persons living with dementia are a national priority in Canada. They are at a higher risk of going missing and getting lost. Our project will work with search and rescue personnel, first responders, and community staff. We aim to build capacities, partnerships, and support their coordination. This project includes 4 initiatives. The first one focuses on education resources for first responders, including fire, police, and paramedics. In collaboration with search and rescue teams, we will create educational resources to understand lost person behavior and inform the practices of search and rescue teams as they organize the search. The second initiative includes a community toolkit for community organizations and care partners. Again, prevention is the critical component of this initiative. The third initiative focuses on return home interviews. Through interviews with first responders and service providers who conduct return home interviews with persons living with dementia, we will develop guidelines for how to conduct return home interviews and pilot these. The guideline developed for return home interviews will help to prevent future missing incidents. The fourth initiative focuses on using data from multiple databases to predict and understand missing incidents from the Canadian context. Findings have the potential to inform search and rescue operations and can contribute to the development and uptake of preventative strategies by persons living with dementia, their care partners, service providers, and policymakers. In general, this project includes the perspectives of different stakeholders, including persons living with dementia, search and rescue teams, first responders, policymakers, families, and community organizations. We want to be able to bring together all of the endeavors to support persons living with dementia and their communities.
I see there's a question about participants unwilling to wear GPS consistently. Actually, that was one of the criteria to be involved in the project, was that they would be willing to wear it and that their care partners would be willing to support them. Of course, there were circumstances where, for example, the device wasn't charged, this was working very closely. We had a rural site in Grand Prairie and then an urban site in Calgary involved, and we had staff, AHS staff, working with us and with the participants regularly to provide support. And I see another question is whether or not we consider PhD student or research assistant. Yes, we have 2 research coordinators, one dedicated to this project, and people can email me if you're interested in either doing your graduate studies or to be a research assistant on the team. But we are desperately now looking for a postdoc as well. We're competing with every other research program. Postdocs are very hard to find these days. And I think there might be 2 more minutes. I'm really sorry for taking up so much time. If there are other questions, feel free to either type it or I think you have to type it. For the Swedish participants, we also are in conversations. I just don't have their names with me. I had it typed, but with 3 researchers in Sweden that are doing exactly this type of research. And so one, in fact, it has an affiliation with the University of Calgary. So we're very excited to be there. Nurses also work in as first responders. So, and there's a social worker and there's another who's a psychologist.
It looks like we have one more question. If you have 2 more minutes to answer it.
Of course.
Have you measured how successful your initiatives have been in reducing missing individuals?
That's exactly what we want to answer. And to do that, we need to have baseline data so that there is consistent definition across the police services and first responder services to identify what is considered to be missing. Sometimes these are not reported, especially when they're found very quickly. Sometimes they're reported, but we don't know if it's the first occurrence or a repeat occurrence. So we need to have consistency in this data and a willingness to share it so that we know any program we implement actually is effective or has an impact.
Well, if anyone has any other questions, let me just quickly check the chat. Okay, it looks like we are done. Thank you so much for this presentation. It's spectacular. I mean, I know that something like this is something that I'm very passionate about, especially the implementation of wearables in safety and consumer technology for research and for healthcare. Thank you. I hope you stay for the remainder of the day, at least for the next little bit. For those of you on YouTube Live, thank you guys so much for tuning in. We will have one more keynote, one more presentation later on today at 10:30 Mountain Standard Time. For those of you who are part of the symposium itself, we are going to have a 10-minute break, and then we will come back to the stage for our technology inspiration. Thank you again, Dr. Liu, and Dean, if you don't mind taking us